Start off with hazard identification. What is hazard identification? What are the agents that cause recreational water illness? They're bacteria, they're parasites, they're viruses. We know what they are. They're also chemicals. The disinfection byproducts, the combined chlorines in the water and in the air. What's a convenient way to group them? Well, you know, there's different ways, and it's like the CDC's got one method that involves a lot of these same categories, and it's also got a neurological involvement in there. But the neurological agents, the Naegleria and acanthamoeba, do not occur in treated waters, and that's what we're managing. So if we look at the categories of illnesses that we're going to have in treated waters, these are the categories that I've used for a few years, and we're going to continue to use these through the NSPF. How serious is the disease caused by each one of these? We want to prioritize the most serious illnesses and concentrate on controlling those. So let's go through the hazard identification. Start off with top category, it's gastrointestinal illness. Got the category, parasites, bacteria, viruses. All the organisms you've seen before, there is nothing new on this slide. If you've ever seen anything on recreational water illness, we know it's E. coli, Shigella, Giardia, Crypto, and norovirus. Nothing new. What's the severity of illness? This is something we have not talked about in recreational water illness before. It's the severity of illness is high. Describe it another way. They generally won't kill you, but if you've ever had one of these, you think you're gonna die. And if you've ever had, I'm serious, if you ever had one of these things, like norovirus hit my family about 5 years ago at Christmas time, that's not much, we don't remember much about that Christmas. We were all in bed for about 5 days. And all of these have that type of severity of illness. If we look at dermal illnesses, Pseudomonas and the combined chlorines and the disinfection byproducts. Pseudomonas is a relatively minor illness, except in 5% of the outbreaks when somebody has to be hospitalized and put on IV antibiotics because it's gone systemic. So it's normally, it's a high prevalence, low severity, but it can be very severe. Combined chlorines, relatively minor unless somebody walks into an indoor facility and you've got high nitrogen trichloride and they end up with an asthmatic attack and end up in the ER. So there are varieties of reactions. Respiratory, if you got two varieties of respiratory infections of Legionella. Pontiac fever, which is the one you would like because it's probably no worse than a mild case of the flu, and you get over it in 24 hours. But if you end up with Legionnaire's disease, it's fatal up to 40% of the time in somebody with severe underlying conditions. Chemicals, combined chlorines and disinfection byproducts, a range of reactions in there. So there are a variety of reactions that we can see as severity of illness. That doesn't tell us much from a management perspective, though. Let's look at where they occur and where we're likely to find them. Break it out in a little bit different category. Infectious agents and chemicals. Look at the gastrointestinal infectious illness. Where do they come from? They do not reproduce in the pool. They are shed into the pool by our patrons and by our infected staff, which have been known to be involved in numerous crypto outbreaks coming from the staff, not from the patrons. But gastrointestinal illnesses is coming from the people in the water. Pseudomonas, Legionella, they're coming from the biofilm. Treatment chemicals, mishandling of treatment chemicals, combining trichlor and calhypo and getting a bomb going off or outgassing a chlorine gas leak. There are a number of cases we're now tracking through the CDC now. It's a significant improvement in tracking of mishandling of chemicals. That's just simply training. And the combined chlorines and the disinfection byproducts, they're formed in the water and they're put into the air. If you look at that far right-hand column, you're starting to identify areas where we can focus on the control of recreational water illness. In 4 of those 5 categories, it's what we can directly control by facility managers. What can't we control? A sick bather getting into the water. So somebody says, oh yeah, I had diarrhea for 5 days, but it's okay, I can get into the water today because I haven't had symptoms for 12 hours. They're still shedding those organisms. So some things we can identify with this, we can readily start focusing on control.